Hello. The muscles of the sole of the foot are arranged in 4 layers. In the first layer, we have 3 intrinsic muscles. The second layer, we have 2 long flexor tendons and we have 2 muscles. In the third layer, we have the muscles which are localized to the metatarsals, and as well as in the fourth layer, we have the muscles which are dorsal interossei and the plantar interossei muscles. And you know, the neurovascular bundle will be running, or it intervenes between the first layer and second layer of the sole. So in this video I will demonstrate the first layered sole of the foot. The muscles I have mentioned, we have 3 intrinsic muscles. One is abductor hallucis, number 2 is abductor digiti minimi, and the third one is flexor digitorum brevis. So the first layers muscles of the sole of the foot. First I will discuss about this muscle. This is abductor hallucis. This muscle is abductor hallucis. This abductor hallucis, it will take origin from the medial tubercle of the calcaneum. It also takes origin from the flexor retinacula, and few fibers also will take origin from this, which is plantar aponeurosis. And you know, this muscle insertion, if you see, it overlaps the trunk or the origin of the plantar vessels and nerves. So here if you see this one, this is the trunk of the plantar vessels. So it overlaps the origin of the plantar vessels and nerves, and it is inserted onto the medial side of the base of the proximal phalanx of great toe. And this muscle is innervated by medial plantar nerve, and action of this muscle is, it is abductor of the great toe. It abducts the great toe. So this is all about the abductor hallucis. Next we have the muscle which is flexor digitorum brevis. So this flexor digitorum brevis, it lies deep to this. Now this is the plantar aponeurosis. So this flexor digitorum brevis, it lies deep to the central part of the plantar aponeurosis. Now I am reflecting this plantar aponeurosis. Yeah. Once I have reflected, you see this muscle. This one. This is the flexor digitorum brevis. Okay. Now this is taking origin from the medial tubercle of the calcaneum and also from the plantar aponeurosis. And when you see distally towards insertion, if you see this muscle, it ends up in 4 tendons. Now I will make it clear. Yeah, these are the 4 tendons. Now it divides into 4 tendons for the lateral 4 toes. Each tendon enter into the fibrous flexor sheaths of corresponding digits, and they spirally blend around the long tendons, which is flexor digitorum longus. And finally these tendons are inserted onto the sides of middle phalanx of lateral 4 toes. And this muscle, it is innervated by the medial plantar nerve, and action of this is, it produces the plantar flexion of lateral 4 toes. So the tendon is moving for little toe, then you fourth, third and second. So lateral 4 toes, we see this muscle is splitting into 4 tendons. This is flexor digitorum brevis. Then we have the most lateral muscle is this one. This is the abductor digiti minimi. This muscle is abductor digiti minimi, and this abductor digiti minimi, it takes origin from the lateral and the medial tubercles of the calcaneum. It also takes origin from the plantar aponeurosis, and insertion, if you see, this passes forwards along the lateral border of the foot, and it glides over this bony prominence, which is the base of the 5th metatarsal, and finally the tendon is inserted into the lateral side of the base of the proximal phalanx of the little toe, this one. And the nerve supply to this muscle is lateral plantar nerve, and the action is, it is the abductor of the little toe. So these are all the muscles you see in the first layer of the sole. So from medial to lateral side, this is abductor hallucis. In the central part we have, this is flexor digitorum brevis, and the lateral part we have this muscle, which is abductor digiti minimi.